very good evening to you. Welcome to this latest episode of My Doctor. I am your host, Purity Museo, and this evening we want to focus on sleep disorders. And if you toss and turn throughout the night, or you find it hard to stay awake during the day, then it could be some of the symptoms of sleep disorders. Now this evening we'll be looking at some of the symptoms, the treatment, how it is diagnosed, and who are even at the risk of getting them. I brought to you a physician who will be taking you through that. Remember, you're welcome to participate in this discussion. You could send us your questions, your comments about sleep disorders. Our Facebook page is My Doctor Ebru TV. On Twitter, we are at My Doctor Ebru TV, and you could also follow me directly on Twitter. I am at Purity Museo. On Facebook, I am Purity Museo. The SMS number to use, the phone number to use just to call us in will be displayed right on your screen throughout the show. But before we kick off this discussion, let's have a look at what's coming up. Are you finding it hard to fall asleep through the night? Do you fall asleep during the day even when you have had enough sleep at night? We discuss sleeping disorders, usually referred to as a group of conditions that affects one's ability to sleep well on a regular basis. The condition can cause hypertension and other serious health complications. Insomnia, snoring, sleepwalking, excessive sleepiness are some of the common types of sleep problems, usually caused by stress, health problems, and other issues. Now, welcome back to this evening's show. We are talking about sleep disorders. If you have any issues with your sleep, do you find it even hard to wake up in the morning, then I brought to you a physician who will be taking us through that. And just to remind our viewers that you are welcome to be part of this discussion by sending in your questions. Just call us in. The numbers to use are displayed right on your screen. On Twitter, we are at My Doctor Ebru TV. On Facebook, My Doctor Ebru TV. My handles are on Twitter at Purity Museo, and on Facebook, I'm Purity Museo. Welcome to this discussion. Thank you so much for making time for us, Doc.
Thank you very much for inviting me to your show.
Yeah, and maybe in few seconds you can just introduce yourself, your name.
Okay, I'm Dr. Saira Sokwala, and I'm a physician working at the Mbagati County Hospital.
Right.
I'm also doing my subspecialization into diabetes, and I have a special interest in sleep medicine.
Right. All right, talking about sleep medicine, let's begin by sleep disorder. What is a sleep disorder? Many people are really struggling with sleep.
Okay, it's very interesting that we take sleep for granted.
Right.
You know, many a times, first of all, you need to understand before even going to sleep disorder, at least what is sleep.
Right.
So normal sleep, how do you define normal sleep? So it is actually a condition of the body and mind,
right,
in which, you know, typically occurs like several hours every night, in which your nervous system becomes inactive, your postural muscles become like kind of paralyzed or relaxed, your eyes are closed, and it's basically like practically a suspension of your consciousness.
Right.
Now, normally to define sleep, it has to be an easily arousable and reversible state.
Right.
That compares now to coma, which is actually irreversible, you see, and difficult to arouse. So that is what normal sleep is defined as.
Right.
So in that context now, sleep disorders is anything which is not normal sleep. Or rather, we can define it as a medical problem which negatively affects your normal sleep.
Right.
Okay, and that subsequently affects your physical, emotional and mental performance, and your basically overall health is affected by that.
Right.
So
what are some of the symptoms that would indicate that this person is not having normal sleep?
So basically, you see, there are multiple of symptoms, and specific symptoms are related to specific type of sleep disorders. There are a myriad, over 70 different types of sleep disorders,
right,
and classified into 7 major classifications. Yeah,
maybe the commonest.
The commonest ones would be insomnia. You'll hear a lot of people talking about not sleeping well.
Right.
So insomnia, sleep-related breathing disorder, or what you call as a restless leg syndrome. So these are the most common in adults. In children, you can have like bedwetting or what you call as parasomnias, okay? So the symptoms as a group, let's just talk about a few of them, because that's very important for people to know that this is a problem, you know. So you'll have problems either initiating sleep or maintaining sleep, which could be in the middle of the night or the later part of the night. And each of these, which time it occurs, it relates to a specific disorder. You could actually have, because now your sleep is disrupted, so you could be having excessive daytime sleepiness. And you know, because you don't get normal sleep, as we might discuss the functions of sleep, but what you get is fatigue. You feel tired all the time. You are irritable. You appear anxious. Even depression is one of the features of not sleeping well. Yeah. And then you'll see whether it's the child or the adult, you see them sleeping more frequently during the daytime. For certain disorders like the sleep-related breathing disorders, of which obstructive sleep apnea is the commonest type, you get a lot of snoring even at night. Yeah. And then during the daytime, all patients who've got sleep disorders, most of them, they have memory issues, so they have issues with remembering. Alertness is an issue. You cannot maintain your alertness for as long as you would if you have been sleeping normally. So these are basically some of the symptoms you could get. Yeah.
And just before we get into these major types of sleeping disorder, how common is sleeping disorder in Kenya right now?
Okay, it's very interesting that, you know, we actually, when I was, we have done a research on sleep disorders in patients with type 2 diabetes. It was actually my thesis, part of my thesis, and you can get it, it's published in BMC endocrine disorders. So we studied people who have diabetes and those who don't have diabetes, age and sex matched, and we found a very high prevalence. You know, we were thinking, people would think in Kenya this is not such a common problem, whereby you're looking at common problems being HIV, TB, you know, the likes, the communicable diseases. But we are having a shift towards now non-communicable. So with diabetes and obesity and all these disorders, the stresses of life today, we are seeing more and more of these sleep disorders. So what we found is that 44% of people with type 2 diabetes are at a high risk for obstructive sleep apnea. Obstructive sleep apnea is a very serious condition actually. It's related to obstruction of the upper airway during sleep. Yeah. And we found that 53% of people with type 2 diabetes have actually got a poor quality of sleep. This was a study done at the Kenyatta National Hospital, which is our National Referral Center. Okay. Whereas in the comparison group, we were expecting a lot lower figures, you know, because you think these are normal, not diabetic people. But imagine we found 30% of them had a poor quality of sleep and up to 9% had a high risk for obstructive sleep apnea. There is another study that has been done by the Warwick University, and it was done in 2012. Here in, it looked at actually about 6-7 developing world. You know, in the developing world, as I told you, we assume these are not so common. But overall, 16.6% of the people studied, this was a huge number, okay? About over 100,000 people were studied. And they found that actually the prevalence is 16.6% of people have poor quality of sleep. And in Kenya, the Kenyan figures, it's like females had a 10.8% problem, whereas men had about I think it was 3.4, 3.5%. So you can see, and the problem was more with advancing age. The more you age, the more problems are noted to be occurring with sleep.
And just before we get to that, just to remind our viewers, in case you're joining us for the first time, what we are talking about this evening and who we are having here on our studios. We're talking about sleep disorders. This is abnormal sleep, according to Dr. Cyrus Sokwala. She is a physician. She's taking us through that discussion. Remember, you're welcome to be part of this discussion by calling us in, send a message. The numbers to use are displayed right on your screen. You're welcome to this discussion till the end of it, and welcome back to this discussion, Doc. And we're talking about some of how common is it in the country. We've seen it's a serious condition in the country, but what exactly causes this sleep disorder? What are some of the things that would make one not to have enough or good sleep?
Okay, the causes can be divided into many causes. Like for example, if you look at just physiological causes or physical causes, you're looking at things like even your day-to-day activity, you know, today we have moved a lot digital,
Yeah.
So there's an increased screen time. So media exposure itself,
Right.
I mean, exposure to social media. You see today teenagers, even adults, sitting for long hours on the screens, relationships on social media, you know. That's just the physiological aspect. Then you come to stuff like physical problems, for example, ulcers, or medical conditions like asthma.
Right.
These are conditions which would predispose you to have an abnormal sleep pattern or waking up in the middle of the night, you know. Then you look at age. Like I told you, even in the Kenyan study, we found that, even in our study, we found that having higher age was, I mean, older age was actually associated with severe, more severe sleep conditions, or more people who are older tend to have sleep problems. And then gender. Even like I said, female gender, because of the hormonal imbalances that women have been found to have a higher risk of sleep problems. You look at the habits, individual habits, even like environmental, looking at environmental factors. Alcohol itself, just consumption of alcohol is related to disturbed sleep. What alcohol does is, in the beginning it makes you sedated, or it improves your sleep, but in the later part of the night it actually disrupts your sleep, so you get frequent awakenings with alcohol intake, okay? So the other factors which are now coming in is the psychiatric conditions. You see the stresses of life. Today's life has become so fast moving, so we have a lot of stresses on us. So anxiety and depression among some of the psychiatric disorders are predisposing now to poor sleep.
Right.
Yeah.
And Doc, is there a difference between someone, or having a night sleep and a daytime sleep? Is there a difference with regards to someone's body?
Yes, there's a very big difference actually. You know, having a good night sleep, and that brings us to what is a good night sleep. Yeah, that's what I think most viewers would be wanting to know is how do you qualify having an adequate sleep? Yeah,
right.
So this is like more or less uninterrupted sleep, and it depends on the age group that you're talking about. So in neonates, for example, newborns, up to 1 month, you're looking at 12 to 18 hours of sleep. That's what they should get, okay, throughout the 24 hours. Whereas in if you look at infants, you are now going a little less. That's like you're going to 12 to 15 hours of sleep. If you look at toddlers, you're looking at about 12 to 13 hours of sleep. If you look at preschoolers up to the age of 5 years, then you're looking at up to about 11 to 13 hours of sleep. You look at, move on to young adults, like young children, basically up to the age of 10 years. And they need about 10 to 11 hours of sleep. At night, that's the best time is to sleep is at night.
Right.
Although children are allowed to sleep even during the daytime, at least 1 hour to 2 hours, depending on now the age of the child. Obviously, neonates, they can sleep throughout.
Right.
Then you look at adolescents. Adolescents are ideally supposed to, that's up to the age of 17 years, ideally supposed to sleep between let's say 8.25 to 9.25 hours. So between 8 to 9 hours, and adults then is supposed to be between 7 to 9 hours.
Right.
So that is your normal sleep. Okay. Now what happens is, why the nighttime sleep is so important compared to the daytime sleep, and why you should get a good nighttime sleep, is because there is something known as the circadian rhythm, which you might have heard of, the biological clock, the body's biological or the circadian clock. Now that clock depends on day and night. Okay. So during the day, automatically there's a hormone that is called as melatonin. There's a substance produced in your brain that's like the sleep, let's say the sleeping pill of your body. Okay. So melatonin is produced when there is darkness. So that is the hormone which basically puts you to rest, you see. And you know, the main concept is, initially sleep was thought to be just a passive process. It's like people used to think it's disruption of your normal day, and you just go on a passive mode, you know. But now it is shown that sleep is actually an active process. A lot of stuff goes on in the brain even during sleep, and that kind of restores your body and your mind. So there are different stages of sleep, and depending on the stage, it's like there's a non-rapid eye movement and the rapid eye movement sleep. Depending on the stage, there is restoration of your body functions or your brain functions.
We will be getting to we will be getting to the stages, but now how do I know that I'm having? Because there are people who will tend to say that, okay, maybe I work longer hours, I will compensate. Is there anything like that, compensating sleep, or once a day is left, you never recover that sleep?
You can compensate to only a certain extent.
Right.
You know, there is the aspect of acute sleep loss and chronic sleep loss.
Right.
Okay. Acute means in the short term. For example, you have an exam. So you are sitting for that exam. Obviously, you are so stressed up, and you'll tend to lose out on your sleep. So you'll be studying late night. Yeah. But just after the exam, you are on a break. So you'll compensate. So in that situation, you can compensate. That's an acute shortage of sleep.
Right.
But you know, there comes a time when you are chronically, if you daily don't sleep well. For example, night shift workers are at a very high risk of sleep disorders.
Right.
Yeah, and the consequences that follow. And we are part of those night shift workers. But okay, we work in shifts, you see, so there are some times that you can compensate your sleep during the night.
Right.
Okay.
Yeah.
But if you chronically don't sleep at night, like the watchman, you know, chronically the whole night, if on a row you don't sleep, then that builds up, and that creates the chronic effects of sleep. That's the long-term effects of sleep.
So what
deprivation.
the stages of sleep, good night sleep? What are they like?
So they are, you can divide them into two main stages. That's the non-rapid eye movement and the rapid eye movement.
Right.
Now the non-rapid eye movement is divided into three further stages. So stage 1, stage 2, stage 3. Stage 1 is where it's just you are like drowsy, you are almost going off to sleep, you are getting sleepy.
Right.
But you can easily be arousable, and you can communicate if you can actually hear your stimuli around you. Yeah. Whereas now you move on, this occupies like about 10 minutes, about 5% of the total sleep time. And then you move on to your stage 2, NREM, non-rapid eye movement. That occupies about 45 to 50% of your sleep time. That's the majority, maximum sleep you spend is in NREM 2.
Right.
Okay? And that is the stage in which now your memory consolidation starts taking place and information processing. Okay? At this stage, you usually don't have dreams. And what happens is your muscles start to relax. Okay? Then in stage 3 non-REM, that is what you call as the slow wave sleep. And that is the time now when the maximum memory consolidation takes place, the deep sleep, you know. So it occupies about 25% of the total sleep time. And information processing and, you know, body function repairs, restoration, that's where it takes place the most in the NREM 3.
Right.
And then you slowly move towards the REM sleep. The REM sleep now, the rapid eye movement is when you've got rapid eyeball movements. Sometimes you can dream in the non-REM 3, but you do not remember the dreams that occur in that stage. And at that point, your body actually like kind of goes slow in the slow wave sleep.
Right.
Your temperature goes down, your respiratory rate goes down, the breathing rate, your heart rate goes down, blood pressure. So you are on a go slow, you see.
Right.
Then in the REM stage, your muscles become kind of paralyzed, atonic. Not the breathing muscles, the postural muscles. So that is the stage where you get the most vivid, clear dreams, you know.
Right.
That's where all the terrors take place, you know. So you get your dreams during that time, and those are the dreams that you usually remember.
Right.
So in the first half of sleep, you've got more of the non-rapid eye movement. In the second half of your night, you get the rapid eye movement.
Right.
Now that's towards awakening, you see. So it's a cycle of about 90 minutes.
Doc, let me just disrupt you for a moment. There's someone who is calling us in. Let's first pick that call. Hello.
Hello.
Yes, hello. How are you?
I'm good. How are you?
Thank you. I'm fine too. What's your name and where are you calling us from?
My name is I was calling from Lamu.
Your name is who, please?
Bismarck.
Bismarck?
Calling from Lamu.
From Lamu, right. Go ahead.
No, I have been having a problem. That sometimes I could maybe sleep very early. Sometimes like 8 a.m.
Right.
Wake up very late, maybe even sometimes at 10.
Right.
And sometimes I hardly have I can stay the whole night without having a sleep, even a small sleep.
Right.
So I just maybe a virus in the same kind of maybe having a sleep disorder.
Right.
And how can the doctor maybe give, what kind of advice can the doctor give me?
Yeah.
The same problem.
Okay, thank you, Bismarck. We are going to respond to your question. Thank you for calling. All right, maybe we could begin by responding to him.
Probably.
Yeah, he's saying that sometimes he has a problem with sleeping very early and then he finds himself waking up very late. Like normally he expects when he sleeps very early, he wakes up early, but he will sleep at around 8 a.m. Then the following morning he's finding himself waking up at 10 a.m. And then sometimes he cannot find sleep at all. Maybe your advice on that.
Yeah, so there is actually like the way it is, there's a whole aspect of sleep hygiene. Okay, and before you even think of taking medicines for sleep or evaluating anything further, first of all you need to establish a sleep hygiene.
Right.
Sleep hygiene, what it means is just like basically consciously following a daily guideline to control your external factors which affect sleep.
Right.
So it is basically just good habits to assist you in sleeping.
Right.
So like what he's saying, it seems like there is no routine in his life as far as sleep patterns are concerned.
Right.
And that could be due to a lot of reasons. It could be the job that he's on.
Right.
It depends even on what activity he does the whole day, what foods he eats, yeah, how long has this problem been there, what stresses in his life are existing. So a lot of factors affect that. But the first step in treating basically, because I would like to know whether he's obese or not, because even when you're obese there's this issue of obstructive sleep apnea, yeah, like I told you, because your neck circumference is big. So obese means you're overweight, you're more than the weight that you're supposed to be. So that affects your neck, especially if your neck is big. So you do not breathe so well at night. So you may think you are oversleeping, but what is happening is actually in the middle of the night, you're having multiple interruptions because you stop breathing or you are snoring. So the best person to ask about that would be the wife or the bed partner or the room partner, to know if he's snoring at night. And the next question I would like to ask him would be if he has excessive daytime sleepiness after that. Does he fall asleep while driving? Does he fall asleep while doing his work during the course of the day?
Right.
That said, that is now going towards obstructive sleep apnea. But generally, sleep hygiene, it's very important to know what it constitutes.
Right.
So, number one, your timing. So, you need to establish regular sleep timings, regular patterns of sleep. So, you keep your, today we have got alarm clocks which never used to exist all those years back. So we can actually time ourselves.
Right.
So let's say you decide I'm going to be going to bed every 8 o'clock p.m. for example, like the way he said he can actually go off early. So 8 p.m. And you wake up exactly at a certain time, you time yourself, you say 8 hours of sleep, and you wake up at that time with your alarm. Okay, so it will make you wake up. So that's like your own willing ability to change. So that's what first thing that you have to do.
Right.
Number two, avoid this oversleeping, because that disrupts your next night's sleep, you see. Number three, it is basically to avoid, foods even. Food plays a very big role, food and exercise. So diet, your diet. So there are certain foods which are high in what you call as tryptophans. Okay, and there are certain foods which are high in tyramines. Now, tryptophans help you to sleep. So just before sleeping, like at dinner, you include more of, first of all, healthy balanced meal is, more of vegetables should be included in your diet.
Right.
Then certain food specific are like bananas, which improve your sleep, yogurt, milk, things like even like warm milk, that assists. Whereas foods which are high in tyramines, like now the caffeine, coffee, anything containing coffee, even soy sauce, simple, I was just amazed, soy sauce even affects your sleep. Okay, so certain foods will affect. So those foods you need to avoid at night. So eat a healthy balanced diet, but avoid high carbohydrate, high sugar at night. That will like disrupt your sleep. Okay. Then as far as exercise is concerned, exercise, people think you do a lot of exercise, you'll sleep really well. It's not the case. Ideally, you should, at least for 3 hours before sleeping, you should not do strenuous exercise, excessive exertion. So the strenuous activity should be kept to the afternoon, at least 3 to 5 hours before. And if you want to take coffee, the interesting thing with coffee is, it actually has a half-life of up to 5 hours. So imagine you should not take coffee at least 3 to 5 hours before you sleep. Ideally, yeah? Okay. Did you know that? Yeah, so 3 to 5 hours before you sleep. Because even at that 5 hours, half of the coffee is still in your blood. Yeah. So imagine if you have just taken it. So the whole night you will be not having adequate sleep. Yeah. Okay? Yeah. So those are some of the sleep. Then alcohol consumption has to be reduced.
Yeah.
I don't think he would be taking alcohol. I don't know. We didn't get to hear that, because alcohol really disrupts your sleep pattern. Tobacco is another thing.
Right.
Smoking or nicotine, that plays an important role. Then what drugs is he on? Certain drugs, medicines, they affect your sleep patterns. Okay, like sedatives themselves, yeah, or barbiturates. Certain groups of drugs, he should ask his doctor if those are causing the sleeping disruptions that he's having. Then how does he sleep during the daytime?
Yeah.
You know, anytime you feel like sleeping, do you just go off to sleep? What activity does he do?
Right.
So a lot of factors play. But if after looking at all that sleep hygiene, if it's still not improving, then he should see a doctor to be able to know if there's a medical condition. Like I told you, there's a lot of medical conditions also associated with sleeping disorders.
Okay, we'll be back to talk about in children. How about sleeping in children? How can a child get a sleep disorder? And maybe you've talked about some of the causes of sleep disorder in adults, which include maybe could be stress and all that. But now for a child, how does it come about, and what is a normal sleep for a child like? But first we want to take a short break. We are back with more of this discussion. Don't go too far.